I am Dr. Kimberly Smith-Dotrieve, as most of you already know. I apologize for being tardy again. Tonight, we are going to be talking about ADHD, trying to figure out what would be a good topic. I came across this as I was looking up some different CBD articles and, the latest and greatest about new health benefits that have been found where CBD is concerned. So this was quite interesting because this is something that I treat all the time. I am an internal medicine physician, and so I treat patients from the age of 15 all the way up to the geriatric population. However, ADHD, as you know, is usually diagnosed in childhood, but we have, it carries over to adulthood, but we have quite a few adults who are receiving an ADD, sometimes ADHD diagnosis even in adulthood for the very first time. And usually that happens because it was missed in, their initial education. How it gets missed? Well, a few reasons. Number one being that it's not actually not diagnosed, but we do have a lot of parents who don't quite understand what it is, why their child should be on medication. We have a lot of parents who are not, willing to put their child on medicine. And I believe when we think about the history, when we think of people who have been on ADHD medication, we typically remember them as kind of being zonked out. We remember, kids who are kind of all over the place, interrupting conversations, can't sit still in their desk, can't concentrate, and all of a sudden you see these kids who are zombie-like. And we don't want either one of those things. So we've had a lot of parents who are just like, nope, I am not doing that to my child. Well, if you have the kind of parent who is very involved and very vested in their child's education and will take the time that is needed to sit with the child, make sure that they're able to maintain their focus and concentration on whatever subject they're talking about, absolutely wonderful. But unfortunately, some kids end up being left behind. Kids who are quite intelligent, but their minds won't sit still for long enough for them to be able to be very, very successful. So this is a subject that I have, plenty of conversations with, especially when I have the teens come in who are truly ADD and parents are not wanting to put them on medication, but the child is failing and the child is actually having a lot of other issues because they're feeling more anxious because they can't concentrate. They are feeling depressed because their grades are falling. And so it's a conversation that has to be had because we want our children to be as successful as they possibly can. ADHD is not a made up thing. This is a truly a medical issue that happens to occur because of imbalance in the brain when it comes to different neurotransmitters. And so we want to make sure our children have the best possible chance at being successful and prosperous. So hopefully this here is going to be, a good presentation for you. So first and foremost, what is ADHD? So ADHD is attention deficit hyperactivity disorder. It's pretty much symptoms of inattentiveness, impulsivity, restlessness, and these are symptoms that end up leading to functional impairment. And these are symptoms that are not going to be seen in only one place. You see ADHD symptoms at home, at school, at church, everywhere that child is, they ought to exhibit these same symptoms. So if you have a child who is at home and is quiet, but the teacher is telling you at school they're fidgeting and they're all over the place, well, then there's something going on. You ought to be able to have similar symptoms in 2 or more different locations. So that's thing number 1. Typically, it does start in childhood, but it will carry over to adulthood. So children have issues when it comes to studying, when it comes to paying attention in class. Adults have issues when it comes to staying on task at their job, completing tasks, completing their job duties. There are 2 different types of ADHD. There is the one that is just with inattentiveness. And for a lot of adults who have this going on, we typically call it ADD, attention deficit disorder. And the other is the hyperactivity and impulsiveness. Adults typically exhibit more of the inattentiveness than the hyperactivity, though there are some adults who will exhibit some hyperactivity as well. And I'm sure you all can probably picture a few adults. Symptoms of inattentiveness include a short attention span, careless mistakes, forgetting to go back to take their time to read the question completely, going back to check their work, forgetfulness, coming in, putting keys down and not even paying attention to where you put the keys, and then you're kind of searching all over the place, trying to figure out where they are. Inability to complete tasks, so homework for kids. For grown-ups, that includes their job duties, and it puts them at risk of being fired because typically when it comes time for evaluations to be done, they are getting poor marks because they are unable to stay on task. Easy distractibility, that is a huge thing in children and adults where they are doing one task and something happens over here and immediately they're off on that task after not finishing the initial task. And difficulty with organization, they tend to be scattered. Things are all over the place. Backpacks for kids are in disarray. Desks and rooms for adults are in disarray. Now, on the other hand, when we're talking about symptoms of hyperactivity and impulsiveness, we're talking about kids not being able to sit still. They're fidgeting a lot. They might bounce their leg a lot, tap their fingers a lot on the desk, making noise. They're unable to concentrate on a specific task because they're thinking about one thing, but something might appear in their brain, in the brain bubble here, and they're all of a sudden thinking about the dog at home, going play, acting without thinking, and interrupting conversations. So a lot of times you'll see these kids, they might raise their hand, but they're talking at the same time. They may interrupt the teacher while she's talking to someone else. But we see the same thing in adults who have the hyperactivity portion of the ADHD as well, where they're intrusive and they're in other people's conversations. And difficulty sensing danger, which is a huge thing because the lack of the proper hormone balance in the brain inhibits people who have ADHD from being able to make those sound decisions about whether something is a good or bad thing, whether it's dangerous or not. And so they have problems sensing danger and pretty much find themselves in some precarious situations a lot. Throughout the US, we have 13.8% of the kids between the age of 3 and 17 who have an ADHD diagnosis. And when we look at the breakdown, 14.7% of these kids are non-Hispanic whites, 16.9% are non-Hispanic Blacks, and 11.9% are Hispanic Blacks. Now, I want to speak on this for a minute because one of the things that we have to do as parents and as the village is make sure that we are in tune with what's going on with our kids and make sure that if the teacher does say there is some type of learning disability, they think your child has ADHD, that you're not just accepting of that, but you do want to look into it. You want to get the proper testing done. A neuropsychiatrist is typically the one who would do this type of testing. A psychologist or psychiatrist can do it as well, but you want to get a true specialist to do the testing that is needed to make a firm diagnosis and not just take it on anybody's word. Because again, this should be something that's going on at home and at school. So for parents who are getting a diagnosis of ADHD from the teacher, that parent should have already seen some symptoms in that child that showed they were not able to concentrate or stay on task, or that they were impulsive and doing a lot of things. This should already be something that the parent knows is going on, and maybe they've been trying to handle it at home. But if you are surprised by a teacher calling and saying, I think your child has ADHD, then you ought to get the proper expert involved and do the right testing to ensure that you're not just putting a diagnosis on your child. And so, when it comes to non-Hispanic Blacks, the next slide will show you that boys are more likely than girls to be diagnosed. Blacks are more likely to be diagnosed than whites. And so we do not want this to end up being a way for our children to be labeled at all. So again, you want to make sure you do your part in ensuring that your child has had the proper testing from an expert, a specialist, a neuropsychiatrist, a psychologist, a psychiatrist. Any one of those. An internist that also can make the diagnosis as well, but if you want firm testing and confirmation, then one of those other specialists will be the ones you would want to see. Other statistics, 7 years old, that is the age at which most children are diagnosed. 6.1 million American children are currently diagnosed with ADHD. 5% of adults have the diagnosis of ADHD, and 70% of those adults do respond well to treatment. And children respond well to treatment as well, but we do want to make sure that we're not trading in one thing for another. Your child should not be taking medication that zonks them out. We don't want medicine that just makes the child just stop functioning, because now we've traded the functional impairment from ADD and then the functional impairment from the medication. Both are hindering the child from truly learning and being the best that they can be. We want a medicine, when it is truly warranted, to help the child to slow down and be able to focus, not slow down and sleep all day. So people who have ADHD, we realize that the issue is that there is a deficiency of dopamine in the synaptic cleft. And this next slide kind of helps with that. So this right here shows what happens with dopamine. And so imagine that you have just won the lottery. And the lottery has to be what, 20 million. Okay, let's just get a good old 20 million here. So imagine the exuberance, the joy, the happiness that you would be feeling. You would be elated. And that feeling causes a significant production of dopamine. Dopamine is released from one neuron and passes on to the next, and that is spread throughout the brain. And so the dopamine is released because of that wonderful, exciting news. I won the lottery. And what happens is it wants to pass that information on to other neurons throughout the brain. So this is the synaptic cleft here. The dopamine is released into the synaptic cleft, and the next neuron to it, it will bind to the receptors there. There are going to be dopamine receptors on that neuron that is next to it. Well, a couple of things are going to happen. The first is that it's going to carry that stimulation. It's going to carry that information onto the next neuron and cause the same reaction to happen. but also it activates our own natural endocannabinoid system. And so it activates our 2-AG and our anandamide, and in turn, our natural CBD is going to come back around in what we call a negative feedback pattern. It's going to bind to the CB1 receptor over here, and it's going to slow down that dopamine. So I know whenever we're listening to Dr. David Allen, he talks about homeostasis. This is what homeostasis means. So we get that surge of dopamine production because we're really, really excited. It binds to the next neuron. It also activates the natural CBD we have in our body. That natural CBD then turns around and comes back up here and binds to the CB1 receptor. And binding here will calm down the dopamine and slow down the production of the dopamine that's being excreted out into the synaptic cleft here. So this is the natural way things happen. Well, in people who have ADHD, there is a deficiency of dopamine in this area right here in this synaptic cleft. And so because there is a deficiency here, we lack what dopamine is going to do for us. So dopamine is what allows us to feel motivated. It allows us to feel excited and happy. It is what gives us our reward. It is also what allows us to sense danger and stay away from dangerous situations. So the lack of dopamine makes you feel more sluggish, less inspired, less motivated. That lack of ability to sense danger, all of those different symptoms that we saw with ADHD, that lack of dopamine is what causes that. So how can we get beyond that? We use medicines for ADHD. And so what those medications are going to do for us is when the dopamine is in the synaptic cleft, what happens is it actually gets picked up by transporters, and it'll bind here to the dopamine receptors. What the ADHD medication is going to do, it's going to prevent that from happening. It's going to prevent the uptake of the dopamine from these transporters and allow it to hang around in the synaptic cleft for a longer period of time. So that deficiency that was initially there is no longer a deficiency because we have a buildup of the dopamine because the medication is preventing it from being taken up by the transporters and the receptors. So why is this important when we talk about CBD? Well, it's important because the research that I was looking at with Olson and Cheer showed that in our brains, when we use CBD, CBD will bind to the CB1 receptors and it will bind to dopamine transporters. So by binding to those two areas, it's going to do two things. And let me go back to this here. So the study shows that CBD will bind right here to the CB1 receptor. So if it binds here, it's going to prevent our natural CBD from binding and stopping the production and excretion of dopamine out. It will prevent that from happening. So whereas typically what should happen is when the dopamine binds to this receptor here, it will activate our natural CBD and it will cause that CBD to come up here and bind to the CB1 receptor. Well, when we use CBD, and we call it exogenous because we're taking it in from outside of our bodies and putting it in. When we use CBD, it will bind here to that CB1 receptor and prevent our natural negative feedback from occurring so that the dopamine won't be slowed down and we have more in that synaptic cleft. It also is going to bind down here to prevent those transporters from taking up the dopamine. So both of those actions that CBD is causing to happen causes more dopamine to build up right up in here in the synaptic cleft where we need it for those who have ADHD, so that there's more dopamine around, which is going to improve their motivation, improve their excitement, improve their ability to focus, improve their ability to sense danger. So a lot of times, you know, ADHD is one of those subjects that is kind of, you know, it's a subject for a lot of heated debates, because there are many people who just feel like, I just do not want to do this. I don't want to put my child on this medicine. This medicine zonks my child out. I know what it's done to other kids. Well, this here shows us that there is so much promise when it comes to CBD in helping with these ADHD symptoms, so that as we continue to get more and more research done, we may have a very, very good alternative to the true ADHD medications in CBD, which is natural, which does cause homeostasis throughout the body. So we're not going to be concerned about it zonking our kids out. We're going to look forward to having that increase in the dopamine and it giving our kids that balance they need so that they can reach their full potential. So again, you know, it's a subject that typically ends up in a lot of heated debates, because we want to do right by our kids in the long run, right? We don't want to hold our kids back. And I'm gonna tell y'all this, one of the things that I realized when I started practicing is I started out taking care of a lot of my classmates from high school. And there were so many of them who were non-Black, who were already on ADHD medication. I never knew that. I never knew it when I was in school. I didn't know it until I was their treating physician. But it made me realize that, you know, there is a culture who will automatically do everything that they need to do to ensure their child's success. We, on the other hand, we've had so many things to happen to us, and we have so many misdiagnoses that we're leery a lot of times when we hear of things like your child has ADHD. I want to tell you one more time that you don't have to fear the diagnosis. You want confirmation. You want to make sure that you get a specialist to do the proper testing to make sure that your child actually does have that diagnosis. And from there, they truly do. We want our kids to be able to reach their full potential. We don't want to be the reason that they're held back or that they're not able to learn because we're not attentive to the fact that there is an issue with their dopamine level in the brain. So this is a real thing. It's a thing that many people in our culture don't believe is true. But I will tell you that if you look up the science behind it, it is true, and it can make such a remarkable difference in your child's life. And so yesterday, the last about this before we get to the wonderful products that can help, I met with a family, and the son is 15, and they were coming in because he had been on ADHD medication, and then he was off of it. And he literally said, I cannot function. He said, I know what to do. I just sit there though, and I can't make myself do it. And his grades went from AB when he was on the medicine to C's, D's, and F's when he was off of the medicine. And so he knew enough to be perfectly honest with his parents and say, look, I need this. His dad said, I didn't want to believe it. I didn't want to believe it. I didn't want to deal with it. He said, but when he came and he said, I feel like a failure. I know what I need to do, but I can't. He said that just turned everything around for him. And so we want our kids to be as successful as they possibly can. We want our adults to be able to thrive. So we know our kind of products are not for people under the age of 18. You know, prayerfully, we will get there in the near future. But for right now, 18 and above. But remember, ADHD in childhood carries over to adulthood. And as far as adults are concerned, the issue now is, can I keep my job? Can I keep myself from being fired? Can I stay on task? Can I complete all of my job duties? And many people can get away. The reason why I see more adults being diagnosed now is because this might have been an issue when they were in primary, elementary, and high school. But if they were not in a program that was challenging, then it was easy for them to get by. But as you get older, when you get to college and you're trying to keep up with the college courses, then you realize, okay, something is not working here. I am not able to keep up. Or when you go out into the workforce and your boss is passing and says, hey, I need you to do 1, 2, 3, 4, 5. And you can only remember, Lord, 1 and 2, what was 3, 4, and 5? There are only so many times you can go back to the boss and say, okay, I'm sorry, I missed that. What else was I supposed to do? So you don't want to put yourself at risk of losing a job that is paying your bills. And it brings on so many other mental health issues, because having untreated ADHD leads to more anxiety, it leads to more depression. And these are things that can be so draining that it makes a person not functional at all. So we can be the best that we can be when we make sure that our brain has the right balance of dopamine that we're looking for. And so knowing that CBD can increase the dopamine levels in that synaptic cleft, we know that we have a wide variety of products through Wakana that are of the highest quality, the purest, the best that you can get, and different forms that you can ingest it with whatever, whatever floats your boat, whatever suits you. But we're going to go through some of these different products so that you can know the different ways that you can get CBD. Now, when we're talking about ADHD, this is a chronic issue. And so we're talking about being able to have CBD in the system as consistently as we possibly can. So for adults who are having the issue with being able to stay focused and concentrating, we want to have a combination of the tincture and the gummy together. Why? They have different onsets of action and they have different durations, but using both of them together will help you to get as close to 24/7 stability with steady state CBD in your system. So the first thing that we're seeing over here, and this is our power line. Power products are full spectrum products. They have up to 0.3% THC in all of them. So if you are anyone that has to do drug testing, you want to stay away from our power products, but we do have a product for you. We have a full line of pure products as well, which are broad spectrum, we've gone to the extra length of taking all of the THC we possibly can out. So pure products or broad spectrum have 0.0% THC, while our power products have up to 0.3% THC. So the tincture, the oral drop is what we see first. The Power Hemp MD happens to be our strongest oral tincture. This product, you put 3 drops under your tongue. You want to start with 3 and you want to work your way up if you need to, but we always want to start with a low dose to make sure that we're not doing too much. You can always add to something. You can't take it away. So if you do 3 drops, you can easily titrate that up if you need to. But 3 drops under the tongue, let it sit there for 1 to 2 minutes, then swallow. It will peak at right about an hour, and it'll stay in your system for about 4 hours. The Power Gummies, on the other hand, when you take it, and our gummies are all infused with CBD, not coated, but infused. So every bit of gummy you bite into is filled with CBD. The Power Gummy, whenever you take it, it will peak at about 4 hours and it will last about 8 to 12 hours. So when you put the two together, you have a steady stream of CBD within your system, and it will be your best bet at maintaining that dopamine level and ensuring that you're able to concentrate and focus the way you need to, to have a good quality of life. The flower is another product that we have, and the flower is our smokable hemp. Smokable hemp is the quickest way for CBD to get in your system. Taking a few puffs will get that into your system in as quick as 1 minute. So for people who are having symptoms such as panic attacks, anxiety attacks, or acute pain, maybe they broke a leg or sprained an ankle, you want to get the smokable hemp on board as quick as possible, because it is how you will get CBD into your system the fastest. And then our Power Extreme Pain Cream, which is my favorite product. I call it my miracle cream, because you put it on any area of your body where you are hurting, and you're going to start to feel some relief in about 5 to 15 minutes. This has worked across the board for every patient that I've been able to use this on. And I have high confidence that it will work for anybody that uses it. And so again, layering is when you're using more than one product at the same time, because you want to make sure that you have something on board working right now, and that when it is wearing off, the next one is kicking in. So as far as we're talking about ADHD, you want to do the tincture and the gummy together to ensure a steady state of CBD in your system. Next products up are the other smokables, and we have here the pre-roll and the vape. Again, the quickest way to get CBD into your system. These products are all power products. So if you have to do drug testing, you want to stay away from them. But if you don't, these are wonderful, wonderful products, especially when you're trying to just bring the stress level down right here, right now, because, we cannot control what stress comes at us. And sometimes when it gets us, kind of blindsides us, we need something that'll work right here, right now, and this will do the trick. We have a full assortment of gummies for different needs. Actually, all of these different gummies, they do have CBD, but they work in some unique ways because of additional substances that are included with them. The King of the Jungle is the first one up here. Our King of the Jungle is our main player in our sexual wellness line. This product should be called King or Queen of the Jungle because it's good for men and women, but it will boost your libido and increase your stamina. Loved by men and women alike. We don't have to worry about the side effects of cardiac arrest, blood pressure dropping too low, passing out. This here is going to give you what you need for your libido and stamina without those harsh side effects. And again, it's good for men and women. Creativity, you want some creativity and focus. You want the Flight Delta 8. Now, the caution sign over it is there because it is the closest thing that we have to the real deal, the Delta 9 tetrahydrocannabinol, which is THC. So if you've ever had trouble with THC, you might want to stay away from this one here. But if you've not had any trouble, this is such an awesome product to use. I hear so many stories of people who are using the Delta 8 and they are completing tasks, projects that they started months or years ago. They are finally getting to them and completing them. New ideas, especially for entrepreneurs. I know a lady who's an entrepreneur, and since she started using the Flight Delta 8, there are so many new things that I can see she is doing and doing them successfully. So for creativity, this is the perfect product, but I also use this when it comes to chronic and severe pain. This to me is probably going to be one of our best alternatives to opioids and the opioid epidemic. When I tell you, I have been able to get patients off of opioids or get them on lower doses of opioids, this Flight Delta 8 has been the reason why. And it has worked across the board. Working with the amount, everybody with gummies, we all start with 1/4 of a gummy. And let me tell you, I do not care how small you think that fourth of a gummy is, it's still 1/4 of a gummy. I don't care how many different stores you bought gummies from, and oh, I took 3 and 4 and it didn't do anything to me, or I smoked the real deal. None of that matters. What I need for you all to remember is what kind of products are the purest and the best high quality products you're going to ever get your hands on. Our gummies are infused through and through. So every bit of gummy you bite into is full, loaded with CBD. So 1/4 means 1/4. Please don't let us have to have you as one of our stories of why not to not follow directions. Next up, we have our pure gummies. Again, if you have to do drug testing, you want to stick with the pure gummies. They are our broad spectrum gummies. All of the THC that is possible is taken out of it. So we have 0.0% THC. You will not have any issues with passing your drug screen with these, but it will still help. Not that it is not effective as the power gummies or any of these other gummies are. It is still effective without the THC. It'll help with sleep. It'll help with anxiety. It will help with stress. Taken in the middle of the day, it'll even give you a boost of energy. But no THC, so it's safe for anyone that has to do drug testing to use it. And again, we have our power gummies right here, which will help with sleep, inflammation, and sex to a degree. But of course, you know, most of the guys love the KOG. We also have some products on our culinary line, which are absolutely game-changing when it comes to our foods. 3 different spices here that add just that kick to your food and makes it even more delicious. We have butter that can go on our breads, the CBD butter, and we have some tinctures that can be infused in our drinks. We also have the Royal Defense line, which is so important in this day and age when we're still battling with COVID. But on top of that, flu season is on us. We have already started diagnosing people with the flu. So Royal Defense is that line of defense we need to give us the extra protection layer we need to avoid these different viruses that are just wreaking havoc in our communities. Well, first up, for the body itself, we have the First Defense nasal spray. Listen, if you have chronic allergies, you should be using this First Defense every day. This thing will give you instantaneous relief. Those were my daughter's words. And let me tell you, she is not one for mincing words. If it didn't work, she'd just be like, okay, mama, that's not good. But this thing works. I had a chance to try it myself, being congested, and absolutely, she is correct. Instantaneous relief, but it does have THC. So again, if you have to do drug testing, this is not going to be for you. But if you don't, please don't miss out on this great benefit. Chronic allergy patients, you know what I mean. It is a horrible thing to have to deal with these flare-ups over and over and over again. Let First Defense nasal spray give you the relief that you're looking for. We have the Essential Defense, which is a drop that you can put on your toothbrush to cleanse the mouth. We know our mouth is the place that has the most germs. So we want to add that extra layer of protection to our mouth. We have the Immune Defense tea over here, which will boost our immune system. But for our surrounding areas, we have the hard surface cleaner. We have produce wash here. Please, Lord, please be cleaning your produce when you get it from the store, because who knows how many hands have touched your produce. And we even have hand sanitizer. The wonderful thing about our Royal Defense line is that it's alcohol-free, kills 99.9% of the germs, works up to 24 hours, so it gives microbiome a run for its money. It's lab certified, and it is all natural. We have our weight loss products, the Flat Belly Combo. This is an amazing combo, and this whole program is absolutely amazing because we have healthy weight loss here. But this wasn't enough. This wasn't enough for our co-founders. They also wanted to make sure that we had every tool that we need to ensure healthy, long life weight loss. So starting off here, we have the bitters tea, which you take over a 4-day period of time, 8 ounces daily, which is going to cleanse our colon, give us the right balance of good and bad bacteria, and get us where the toxins are gone, and we have a boost in our metabolism and the right absorption of nutrients. Then we want to follow that with the flat belly brew coffee and the flat belly gummies. The fat belly brew coffee has CBD, but it has it combined with Garcinia cambogia, which is going to prevent fat storage and absorption, and green tea to boost your metabolism. The Caralluma fimbriata in these flat belly gummies are going to help with appetite control. And so you're not going to just want to go out and binge eat. You're going to want to make a good, conscious decision about healthy food options. And combine that with our Flat Belly Lifestyle 2.0, which is a program that our CEO has put together now with Dr. Eric, giving people all the tools they need for healthy weight loss and long life weight loss. And right now, if you're interested in doing this program, which I recommend for everybody, please get with the person who invited you to this presentation so that they can get you started with the Flat Belly Lifestyle program and all that it has to offer. There's a grocery list, there's an ebook. Again, the founders are not just interested in you buying products. Our founders are interested in you living a better, healthier life. And that's what this program is going to do for us. We have the Power King T'Chaga. This is our only capsule, the only product that comes in capsule form, and it has as a main ingredient with the CBD, the chaga mushroom. It is loaded with health benefits, everybody. It's anti-inflammatory, antibacterial, anti-tumor growth. It boosts your immune system, but it also can help lower the cholesterol and blood sugar levels. Sorry, y'all, I have this slide. I was trying to color coordinate. Sorry about that. But here you go, once again, the Power King T'Chaga. I think this is just letting you know that you really, really, really need to look at this product because it is awesome. Everyone actually should be using this. I consider this product actually as a super multivitamin because it gives you the correct balance of many of the different things we need for our bodies to be healthy, for us to have that homeostasis, the balance that we're looking for, but we have the relief of the inflammation as well as that boost in our energy. It helps with the gut. So it's that super vitamin that can be used by everybody. It does have THC again. So if you have to do drug testing, unfortunately, not the product for you just yet. Essential oils, we have a full line of essential oils. And this is also important because, you know, people have essential oils, just like these CBD stores you see on every corner. It's almost like you see essential oils everywhere you turn. Well, we want to make sure that we're giving you the best that we can give. So that's why this line is an important line, in my opinion, because now we have the essential oils that we're looking for different things, for different reasons. Like that black seed oil, listen, if you don't know about black seed oil, you need to look it up. It has a tremendous amount of health benefits. It will upregulate beta cells in the pancreas and increase insulin production by your body naturally. I have had people use it for a foot fungus and it's helped. I've had people use it for a tooth abscess and it did help to numb the pain. Now, these things, when it comes to all that the black seed oil can do, is all possible because Wakana ensures us that we're going to get the best products that we can possibly get. And we have that assurance because every product has a certificate of analysis. Every product goes to a third-party lab that specializes in hemp, that ensures us that there are no pesticides or chemicals and that we have the purest and highest quality products that we can ask for. Our sexual wellness line is here, and you see the king of the jungle once again, but we also have the G-Spot lube. There is a cherry bliss lube that is edible, and we have some body butter as well that smells amazing, but will give your skin the balance that CBD can offer it. We have healthy hair. Y'all, if I don't know how many of you have followed my journey, or if you're hearing this for the first time, but my hair, I've always had a good head of hair ever since I was young. And tragedy struck my family a couple of years ago. And when I tell you my hair shed, it shed so much that I felt like I could make a wig with all the strands that I found on the floor. And my hair thinned out so much that I kept it just kind of in a ponytail or pulled back because I didn't want anybody to notice how thin it was. Well, then here comes Wakana and the Hempower Hair and the SOS Hair Care System. And they have restored my hair to where it was before. So very, very few strands are falling now. My hair is healthier, it's stronger, and it's longer. And I owe it all to Wakana's SOS Hair Care System and this Hempower Hair. So the Hempower Hair, actually, you put it on the follicles and rub it in. And you let the follicles be relieved of their inflammation. They become healthier. They produce healthy strands of hair that are stronger, and they will grow longer. And for men who are looking for that full healthy beard, the beard and scalp oil is for you, and it will do the same thing. So combining that with the SOS hair care system, and you have a winning combination. This SOS Save Our Strands hair care system is the truth, as one of my business partners like to say. It is the truth because it gives your hair the strength and the health that you're looking for, so that you don't have as much shedding of your hair. Your hair is thicker, it is healthier, it is longer, and it restores the glory. The glory of women is their hair, the Bible tells us, and it will restore your glory with the shampoo, the conditioner, the leave-in detangler, the hair cream, and the oud body oil, which you can use on your skin. This oud body oil is, look, it's a multiple hitter, a multiplayer. It works on the skin. It'll help with rashes. It'll help to relieve itching. It really has been helping with eczema. A lot of business partners are saying how it has helped with their eczema, but it also will help with your hair and with the sheen that you're looking for your hair. So this combination of the hair care system, it can be bought together as a full system, or you can buy the products individually. But if you have been having issues with alopecia because of weaves, because of hormone imbalances, this is definitely the system for you. And so in conclusion, ADHD is a real thing. There are alternatives to treatment than prescription medication if you're an adult. For kids, not so much yet, not when it comes to CBD, but I'm pretty sure that we're not too far from being able to use it in kids because of how effective it is. But remember that if you're an adult and you're dealing with ADHD, then the tincture and the gummy together twice a day, 3 drops of the tincture twice a day, a 1/4 of the gummy twice a day is where you want to begin, and just kind of see how your symptoms are, and you can titrate a little bit at a time from there. But it will give you that boost in the synaptic cleft of the dopamine that is needed for you to be more attentive and focused and able to complete your tasks. So I hope that this was a interesting subject for you. Let me see what is here in the chat. Hello, everybody. Thank y'all so much for being here. All right, well, thank you, Rashawn. Thank you for that. All right. Thank you, thank you, thank you, everybody. Thank you, Ms. Deborah. Yes, I love it too. That hair care, y'all, I'm telling you, it's so awesome. Oh, look, my business partner Lisa said the oud oil also helps with frizzing. And that is the truth as well. I went to a football game last weekend, and exactly that. Frizz, 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 puff is what I like, how I call it. And I put that oud body oil in my hair and I wrapped it. That's how I go to bed every night. I wrap my hair up. And the next day, it was back to how it originally was. It definitely helped that free. I wish I should have put it on before. I didn't think about that. Yes, Miss Karen, natural hair, absolutely. My beautician has natural hair. As a matter of fact, my beautician uses the hair care system now, and she said that her little boy has eczema in his on his scalp, and she has noticed that the eczema has cleared up since she started using the hair care system on his hair. All right. Thank you. Thank you. Thank you. So for psoriasis, actually CBD is very, very good in general for psoriasis. So using the tincture or the gummies can be helpful. Using the oud body oil can also be helpful. What else? What else? What else? There was something else. I lost my train of thought. But the oud body oil, the tincture, and the gummy for psoriasis. Now remember, psoriasis is an autoimmune disorder. So you can put some topical on there that'll help with the itching, and it'll help with the inflammation. But as it is an autoimmune disorder, you really want to get something inside your body. So I definitely would recommend the tincture and the gummy for autoimmune disorders. Same thing like ADHD. Those are chronic issues. So anytime you're dealing with a chronic issue, you want to make sure that you have the CBD on board consistently around the clock to make sure that there's as much of a steady state of CBD as possible to take care of those inflammatory processes that are going on. You are welcome, Miss Pam. Well, everybody, thank y'all so much. Y'all are welcome, welcome, welcome. Multivitamin, can I take King T'Chaga? I'm already taking a multivitamin. Can I take King T'Chaga? Yes, you absolutely can, because I can guarantee you your multivitamin is not going to have the chaga mushroom nor the CBD in it. So absolutely you can take the King T'Chaga, and you're probably going to realize after a little bit that you probably are not going to end up needing the multivitamin, but yeah. Yes, ma'am. Thank you, Ms. Lisa. Black seed oil also for the psoriasis. Yes, absolutely it can. Absolutely it can. See, Lisa, I didn't bug my people today. I normally bug Lisa and Janine to be on with me so they can answer some questions and help me out. So Tamika said, my mom has been using the SOS hair care system for 3 weeks now. Her hair was thinning and there is already a difference. So yay, yay, yay again for that. That SOS hair care system is absolutely amazing. You know, all of the Wakana products are truly amazing. I want to share with y'all that when I got started, I knew nothing about CBD whatsoever. And so everything that I've learned has been through educating myself. And when I decided to move forward with this and introduced it to my patients, so many patients were already using CBD from all the stores, from gas stations. It was crazy. And so I have told them, okay, you can use the Wakana products, but make sure you start with 3 drops of the tincture. One of my patients said, oh, I drink the whole bottle and it doesn't do anything. And I'm like, okay, ma'am, please, please, please don't do the whole bottle of Wakana. You have to do 3 drops. And she didn't listen, y'all. She didn't listen. So she did have to call. She called and told on herself. She said, I had to apologize because I didn't listen. I didn't drink the whole bottle, but I didn't listen. And yes, it packs a good punch. Yes, it does if you don't use it correctly. So 3 drops. These products are absolutely the best that my patients who are now Wakana customers, in comparison to everything that they've tried before, Wakana definitely has beat them all out, all of them. Okay, and it's the beard and scalp oil. All right, send. All right, any other questions? Thank y'all so much for hanging in there with me today. Thank you so much. I appreciate you. It's 9 o'clock on the dot. Good night. See y'all next time.